I'm Manisha Dev. Currently, I'm pursuing my MBA at IIM Ranchi and working with Rare Minds as ambassador of Buzz. So
Okay.
my question is, sir, that we haven't known the fact that the healthcare system in India is not that advanced, and also that the rural population is not able to access even the basic healthcare amenities.
Mm-hmm.
And the doctor to patients ratio, if we see, it's 1 to 1,700. So
Mm-hmm.
in this case, we see that AI as a disruptor in healthcare industry, it can do a lot. So what is your thought about how it can potentially change the healthcare system in India?
Okay. So one thing we need to understand when you're talking about AI will be able to help us if we have the data. If we do not have the data, AI is not going to help us. And this is a main problem in the healthcare, that not everything is been digitalized till now. If we talk about the prescriptions, if we talk about the reports, now things have started to make a digitalization. When I say digitalization, that means data is converted into electronic, and we are able to access it over the internet or the computer. Now, if I talk about AI will be going to help us when we have plenty of data, not the small pieces of data which has been scattered at various different sources. So a lot of work need to be done to harness the power of AI. If we talk about the example of other countries, they are quite rich in their data. If we talk about the devices only know that to which patient they are connected and what are all the details they're getting for the patients. Now doctors are taking the input from those machines and helping us to take the informed decision, because they want to take quick decisions. But in the case of we are still struggling to get the data digitalized. And once the data is not digitalized, then I won't see that AI will going to can do much at this point of time. But yes, more and more data we have in the digital form, there will be a lot of applications will come across. You will see that a lot of apps have come where they are talking about the health of a person. They are monitoring the pulses of that person. I have seen that there's a like a carpet which has been outside the bathroom, and a person comes out, it measure the BMI of that person, it measure the weight of that person, okay, and give a digitalized message that how good the person's health is, right? So a lot of innovation is been happening, but all is depending on that how easily they can extract the data, first of all. And second thing is, if I wanted to do some proactive actions, I need to have a rich data source with me so that the models can be built on it. And because we're talking about the healthcare, so we cannot take chances that we're getting the wrong responses, because a lot of responsibility comes there. Now, if for example you are a doctor and I'm a patient, and you have said something to about the prescription and all, so do we have some mechanism where everything is getting documented in the form of digital with me? And am I ready to save that information on the cloud, so that if I go to Dr. Sangeeta or Dr. Gyan or Dr. Priyansha, are they connected and are they able to access my information or not? If that data is not available to them, then the quick actions will not be there. So this is what my point here is. Before applying AI, we first have to connect the data. We first have to collect the data, and then only AI is going to help us.
Okay, so thank you, sir.